Welcome to the Nutrigenomic Nation podcast with Brian Highfield, certified nutritionist, author, speaker, and founder of multiple successful companies in the health world. Brian is known for educating healthcare professionals and others on improving their health and their life through breakthroughs in nutrition, technology, and biochemistry. On the podcast, Brian interviews thought leaders in the world of nutrition and natural health. He and his guests share the secrets of a whole life natural approach to health and the life-altering results you can get by making easy changes to your diet and daily routine.
Well, welcome to another episode of Nutrigenomic Nation, where we talk about topics related to your genetic health. And so today we have a very special guest. We have Dr. Andrea Luise. So Andrea is a chiropractor, and she's been practicing since 2003 and has owned and operated her own practice near Austin, Texas since 2006. She's nationally board certified in non-surgical spinal decompression and is also working on her certification in neurology. So welcome to the program, Andrea.
Thanks so much for having me.
For sure. And our audience wants to get to know you a little bit. So can you tell us a little bit about your background and what made you want to become a chiropractor in the first place?
Yeah, it was kind of an off the beaten path journey. I started undergraduate school for oceanography and then took a hard left into chiropractic. I was actually nannying for a family over the summer in college, and the dad was a chiropractor and the mom ran the business. And so they brought me into the office to help out there and then help out at home some. And so I was exposed to chiropractic for the first time, and that was incredible. And I knew I had always wanted to study medicine, but I've always been in the more natural realm. And so doing pediatrics or MD wasn't really for me. And so when I found chiropractic, it was just the perfect fit for what I wanted to do. So awesome. I revamped my whole college education and went off to chiropractic school.
All right. And not often do you see to go to school for oceanography and then switch over to chiropractic, but that's pretty, that is a hard left. As you put
it was. Yes, it was. But I'm glad I did.
Yeah. So talk a little bit about your specialty here, which is non-surgical spinal decompression. What is that exactly?
Yeah, so it's for any patient who has a disc issue. So whether that's a disc bulge, a herniation, sciatica, nerve impingement, neuropathy, spinal stenosis, those are my people. That's who I take care of. And what non-surgical spinal decompression is a treatment that allows for spacing for a compressed disc where it's been squeezed and it's bulging and perhaps pressing on a nerve. We allow for a lift in that specific disc region to allow for more space. So we see pain relief usually 90% of the time. It's huge.
And that was my first question. I mean, what do patients experience that they would seek your help? Is it primarily pain? Is that the primary symptom?
Yeah, I mean, disc issues are so huge. They're incredibly painful. Discs are covered in pain fibers. So the pain is parallel to childbirth, passing a kidney stone, like it's up there. And so people have generally seeked out all kinds of care and are still dealing with the symptoms. And so it's usually pain relief that they're coming to see me for, but it does bleed over into all aspects of their life. A lot of my patients who are active and fit and healthy suffer from a disc issue and are suddenly taken away from their sports. They're taken out of their lifestyle. They can't even sit to watch a movie or sit at the computer to work because of the disc issue. So it really does affect everything from pain to mood to lifestyle.
So they're seeking your help. Now, what can they expect like on their first visit to you if they're suffering from back pain? How does that first visit go?
Yeah, so first we start off with a consultation and try to figure out, first off, are you in the right office? Is this something that I can help with? Something that we can work with? And generally I refer for an MRI first if they don't already have one. If they've already been through pain management or an orthopedic, then they usually have one. But if not, then that's the first item, first order of business is to see what's going on specifically. Spinal decompression works best when it's targeted at a specific disc. And if you don't know which disc it is, then the treatment isn't super beneficial. So starting off with that, and then the first treatment session usually is not a lot, honestly. We have to start really gently with how much pressure relief we put in, how much tension, and then how much time we do. And that generally increases over time. So the first visit is pretty easy breezy. The patient, it just lays on the machine while the traction does all of the work. So it's very passive, but there's no pain at all, ever. So that part's good.
Good. And so you mentioned, different, what it could be. You mentioned, a bulging disc, herniated disc, sciatica.
Mm-hmm.
I mean, what are those different things for the people that are new? And I know a lot of people have heard those terms, but not necessarily know the differences.
Yeah. So, well, I can show you.
All right.
So if you
I
have
love models. That's great.
right? I'm a visual person. So if you look at the spine from the side here, you've got vertebrae, and then disc in the middle. This is a spinal cord running down the back, and then spinal nerves that exit out right and left. So at every level in the spine, you've got this setup going on. And so if you have a bulge, it's when that happens.
Wow.
So when this pushes against this nerve, that's when the pain will radiate. In the neck, it goes down into the arms and hands. And then in the lower back, it goes down into the legs.
So a bulge is kind of like it's kind of bubbling out there and putting pressure on the nerve.
Yes. And a disc, the way I explain it to patients is that it's essentially similar to a jelly donut. You've got a center part that's really soft and squishy, and then you've got these tough outer fibers on the outside. If the outer fibers break down, generally you have a bulge. If that jelly actually goes through the crust, then that's a herniation. So they're just different levels of severity of the same process.
Okay. And talk about sciatica. What is that?
Yeah, so the sciatic nerve is the largest nerve in the body, and it exits down from the lower back and then generally goes right down the back of the leg, straight down the buttocks, straight down the back of the leg, all the way to the floor. So if someone's experiencing sciatica, they can have sharp shooting electric type pain all the way down their leg. Doesn't always go all the way down. Sometimes it ends at the back of the knee or the base of the buttocks, but usually it's in that pain pattern. And so that's just it's the largest nerve, and we happen to sit on it. So it's the most affected one that I see.
Great. What else? There was a couple others I think you mentioned that I may have forgotten. So we covered those three. What other conditions could there be?
Yeah, spinal stenosis is a big one. Stenosis, stenosis is just a fancy way of saying a narrowing of a tunnel. And in the spine, you've got 3 tunnels that you want to stay nice and open. You've got one for the spinal cord here, and then at every level, you've got one right and one left for these spinal nerves to exit out. So when you have stenosis, it's narrowing of a tunnel, so there's less room for that nerve to flow. If there's a disc in the way, then there's even less room for that nerve to flow. And as soon as you have pressure against a nerve, that friction will cause numbness, tingling, sharp shooting pain. You can lose strength, you can lose muscle reflexes, and you can lose dexterity. So it's pretty big.
Awesome. So you mentioned the treatment was pain-free. So exactly what do you do once you isolate what the issue is?
Yeah, so it's going to be a really specific, gentle, movable stretch to the spine. And so depending on where it is, either in the neck or the low back, that's where vast majority of people have disc issues, hardly ever in the mid back because we have a lot more protection with the rib cage. But what they'll do is they'll lay on a table face up on a specific table. They're kind of wrapped up and locked and loaded to keep stable. And then based on the angle from the table to the computer software, that is what dictates what specific disc level we're going after. And then what'll happen is a stretch into the spine. So we stretch and hold and then release half of the pressure, and then stretch, hold, and release. Super, super gentle. A lot of my patients take a nap while they're on there, or they listen to a good podcast. But they'll just generally relax. And so that movement to the disc allows to reposition it. So we create space where there wasn't space before.
Awesome. So are there at-home exercises, this person that you give them homework to do at home, or do they have to continue to seek treatment, or what's the long-term lifestyle that the person has after they seek treatment?
Yeah, that's a good question. So I usually refer for postural exercises, something like Pilates or core strengthening. They can do that with a physical therapist or a personal trainer. Long term, the disc itself, once it's damaged, it has very little healing. Discs do not have vascularity to them. There's no blood flow. So it's one of the few places in the body that once you have damage, it's pretty permanent. And so it does require long-term care. So what I do is at the beginning of treatment, I'm usually seeing somebody a couple times a week for this, and then they phase off into maintenance care, which is usually more like once a month. So if they're doing well in between, they just pop in once a month for a tune-up. We keep that disc in check, and then they can go do life the way they want to.
Oh, awesome. So how is being overweight or being obese, is that a factor in some of these issues?
Yeah, more so in the lower back and the lumbar spine, because as the center of gravity shifts forward, with carrying extra weight around the middle, it can put more pressure on the backside of the discs, and that's where they tend to bulge, is off to the back and usually off to one side. So that's why most people will have nerve symptoms on one side, not usually both. But yeah, carrying extra weight or not having good core stability, that plays a huge role because you're tending to lift improperly, without great form, just on a day-to-day basis. And then not having that stability built in. There's not a lot of protection for those discs.
Now, is there a part of your treatment, are there any tips from a nutritional perspective as far as, because I know nutrition can impact the health of the disc itself and the actual fluids and everything inside those discs. Is that part of your curriculum?
Yeah, actually, one of my pieces of homework for each patient who receives this therapy is to hydrate with electrolytes. And so the electrolytes contribute to the muscle tone that surrounds the disc. And so in order for us to get a really nice stretch in that specific disc level, those muscles have to be willing to move. And so I'm a big pusher of electrolytes. And then I ask my patients to minimize sugar in their diet, especially processed sugar, because it contributes to inflammation. And so the more inflamed we are, the more sore and pain, in pain we are. So I try to, ask for modifications on that. As far as supplements, there are a few that are somewhat helpful, but it's really more of those big, like long-term lifestyle changes that make a difference.
Awesome. So is there anything about the non-surgical spinal decompression that we haven't talked about that you want our audience to understand?
Usually results are seen within 3 to 5 visits. So once they are in for usually 2 to 3 weeks, they're feeling a significant difference. And it is something that I'm nationally board certified in. You don't have to be to do that therapy. And so that's something to look into if you're considering it for treatment, to do your research and try to find somebody who is.
Awesome. So, and you're also working on certification in neurology. What made you interested in getting that certification?
I'm just fascinated by how the brain works and development, and my undergrad degree is in psychology, and that's just stuck with me throughout my years in practice. I think I use that sometimes that information just as much as I do chiropractic knowledge with working with patients. And so I am just extremely fascinated by how the brain works and what we can do to help ourselves with mental health. I see a lot of that in my practice with my patients who are dealing with pain, and pain bleeds over into a lot of chronic depression. And so if there are any ways to help handle that naturally, or even with medication, but at least to catch that, so we're talking about it, is really big. But yeah, I just nerd out on neurology.
Yeah. Awesome.
Yeah.
And so if you had a megaphone and you have, you're in a stadium, tens of thousands of people that want to just improve their health, they just want to feel better. What's your advice if you're handed the microphone and can talk to all those people at once?
Yeah, it is to make changes, to get up and move. And if that means getting out of pain first so you can be active, that's whatever needs to happen to make that happen. But our bodies crave movement, not only for our physical health, but also for our mental health. And so if we are able to just get out and walk, our bodies will thank us for us. If we're able to incorporate any kind of movement with community, that's even better. But yeah, just do something to take care of your body.
No, that's awesome. I think that's good advice. Just get out there and move. I think a lot of people can benefit from that. How can our audience get in touch with you or find out more about you, or maybe have questions or just want to learn more about spinal decompression?
Yeah, my website's probably the best way. I'm at lakewaysspine.com. My office is just outside of Austin. I've been here for 15 years now. On Instagram, you can find me at Dr. Andrea Luise. So you can find me there. I'm usually posting weekly videos on physical and mental health, so you can check those out. But yeah, my website's probably the best way.
Awesome. Well, great. We appreciate you being with us today. So we hope our audience has learned something today and enjoyed this episode of Nutrigenomic Nation. And next time we'll talk another topic related to your genetic health. So thank you so much. Dr. Andrea Luise has been our guest today.
Thanks so much for having me. Appreciate it.
Absolutely. Thank you so much.
This show has been produced by Market Domination, LLC. To discover how you can have your own show completely done for you and turn it into a real published book and become the authority in your marketplace, go to www.marketdominationllc.com/podcast offer.